problem itself is, again, all anyone focuses on today is how can we reduce the cost of healthcare, when they should be saying is what can we do to help people be healthier.
CareATC combats the rising costs of healthcare in America by working directly with organizations to finance primary care or wellness centers. And we don't bill any third parties. We work directly with organizations, and we created a new method of financing primary care. The neat thing about it is that the patients there's no out-of-pocket expenses for the patients to access that care. And so that financial barrier to care that's out there in today's healthcare model doesn't exist within the CareATC model.
I was president of the Self-Insurance Institute of America, which put me in Washington, D.C. quite a bit. And I listened to the conversation there, and it was, we'll never do anything about healthcare costs until we put the payor and the provider closer together. And the assumption is that the payor is the patient. And that was the assumption in Washington, D.C. then, still is today, as well as in the public. And in our country for 70 years plus, the primary payor is the employer. And so I came back from one of those trips and thought, if there's a way to put the employer and the provider together, we might be able to make a difference. And that was the beginning of CareATC, and we put a physician on site at an employer in Arkansas. And it was very successful. We did that for 3 years. Once we saw that worked, then I began CareATC in late 2000. And so we've been, almost 12 years now, I guess. And we've been doing that since then. It's actually bringing a physician either on site or near site to an employer, so that the physician can establish that one-on-one relationship with the patient and start to make a difference in their lives and in their health.
Our mission at CareATC really, honestly, is to achieve better health. Health is the essential building block for all human activity. Our belief is that we're not going to have an impact on our clients' future healthcare costs and our clients' employees' future healthcare costs until we affect the health of the people in the group. And that, simply put, is our mission.
The tools that CareATC uses, number one, are the issues with ease of appointment scheduling and accessibility. Having on-site or near-site clinics that allow an employee to see a provider easily, quickly, are huge parts of determining the health of an individual. By offering a PHA, which is our personal health assessment, we're able to get a great snapshot into that patient's current health status. By allowing the physicians to see that snapshot of a patient's health, we're able to plan treatment more quickly, more efficiently, and therefore provide better health care for that patient.
There are so many barriers to care out there today, and that's the reason we're even in existence today. From a financial perspective, copays are totally removed when you're attending or going to a CareATC Wellness Center. No copay, no coinsurance, no deductible. Everything that takes place in the confines of the Wellness Center at CareATC is free to the patient. The savings that we've experienced at CareATC for our clients has been significant. Our core group of employers that we really collected all the data on so we could tell our story consisted of about 13 employers and about 7,000 employees. This group experienced a $1,300 per employee per year savings over a 5-year period, which was equivalent to about $9 million per year. We always tell employees when we go through the orientation process that if they have a relationship with a primary care physician, we are not trying to come between them and that physician. In fact, we congratulate them. We encourage them to maintain that relationship with their physician, but we also encourage them to utilize the Wellness Center in conjunction with their physician. Why pay a copay to go get a lab draw when you can have it done free at the CareATC Wellness Center? We'll forward that information to their primary care physician. But the real target that we're seeking are the people that do not have a relationship with the primary care physician. And the majority of the people in most workplaces do not have that relationship, and they don't seek care until the seriousness of the issue outweighs the hassles involved.
I would encourage patients to simply try it. I think once they try the on-site or near-site clinics along with the PHA process, they'll be pleasantly surprised. The ease of accessibility and the relationships that our wellness centers have with the patients is above and beyond what you might get on Main Street. I would just ask that they try it and at least get that basic assessment as to where their health status is currently.